Most people believe colon cancer only happens to older adults, but that's no longer true. In fact, doctors are seeing a surge of colon cancer in people under 45, even those who appear perfectly healthy. And the scary part, many of the earliest warning signs are so subtle, you might dismiss them as something minor until it's too late. Today, we uncover 7 symptoms of a colon cancer that often go unnoticed, but can save your life if you catch them early. Colon cancer develops when healthy cells in your large intestine begins to grow uncontrollably. At first, these cells form small, harmless polyps, but over time they can mutate into cancerous growths. The earlier you spot the signs, the higher your chances of a full recovery. According to the World Health Organization, early stage colon cancer has a 90% survival rate, but late detection drops in below 50%. Let's look at the symptoms your body might already be trying to show you. If you suddenly notice diarrhea, constipation, or a thinner than usual stools for several weeks, that's a red flag. Colon cancer can partially block your intestine, altering how waste move through. Tumor interferes with the water absorption and the muscle contractions, changing your stool consistency. Occasional changes are normal, but if you persist longer than 2 weeks, see your doctor. One of the most common yet most ignored signs is rectal bleeding or blood mixed with the stool. Bright red blood may indicate lower colon or rectal issues, while dark stools often point to bleeding higher up. This happens because the tumor reroutes the liquid blood vessels as it grows. A study in gastroenterology showed that over 50% of colon cancer patients reported blood in their stool within months of a diagnosis. Never assume it's just hemorrhoids. If you see blood more than once, get tested immediately. Feeling constantly tired, even after sleeping well, could be a sign of internal bleeding from a tumor. These lead to iron deficiency anemia, depriving your tissue and the brain of oxygen. Colon cancer can also release inflammatory molecules called cytokines, which disrupt energy metabolism. If you feel drained for weeks and can't explain why, ask your doctor for a simple blood test to check iron levels. If you lost more than 5% of your body weight in a few months without dieting, your body could be fighting something serious. Cancer cells use up enormous energy as they divide, stealing nutrients from healthy tissue. They also release chemicals that suppress appetite and speed up metabolism. Unintentional weight loss is one of the earliest warning signs of many cancers, including colon. Discomfort that doesn't go away, especially on one side of your abdomen, can signal blockage or inflammation in the colon. Tumors stretch the intestinal walls, press on the nerves, and trap gas, leading to cramping or bleeding. As the cancer progresses, pain may become constant or sharper. If bloating or cramp persists despite dietary change, don't ignore it. These symptoms often surprise people. Even after using the bathroom, you may feel like there is still a stool left. This occurs when the tumor presses on the rectal wall, preventing full evacuation. Many dismiss this as a digestive issue, but when it happens frequently, it may be a sign of a growth inside the colon. This sensation of incomplete bowel movement is subtle but significant. Pay attention if it's new or persistent. When a tumor partially blocks your intestines, food can pass through normally. This leads to nausea, vomiting, and early fullness even after small meals. You might also notice burping, reflux, or sudden aversion to certain foods. These symptoms, especially when combined with other digestive issues, should never be ignored. Eat more fiber-rich foods. Whole grains, legumes, fruits, and vegetables feed your gut bacteria and reduce cancer-promoting toxins. Fiber speeds up stool movement, preventing waste from lingering in your colon. A 2021 meta-analysis found that people eating high-fiber diets had up to 35% lower colon cancer risk. Limit red and processed meats. These meats contain heme iron and nitrates that can carcinogenic nitrosamines. The WHO classifies processed meat as a group 1 carcinogen. Try replacing them with fish, beans, or tofu. Stay physically active. Exercise improves gut motility, reduces insulin resistance, and lowers inflammation. All protective against colon cancer. Aim for a 30 minutes daily, or moderate movement. Maintain a healthy weight. Obesity raises levels of insulin and IGF-1 levels, hormones that promote cell growth, including cancer cells. Even losing 5 to 10% of the body weight can reduce your risk. Get regular screenings. Colonoscopy can detect precancerous polyps before they turn malignant. The American Cancer Society now recommended a screening starting at the age 45 or earlier if you have a family history.
Debated is
Colon cancer doesn't strike suddenly, it whispers first. Your body often gives you subtle warning long before things turn serious. This involves whispers, because the earlier you act, the higher your chance of the full recovery and the longer healthy life.
The dopamine pathways, similarly to addictive substances. Rich foods may be addictive. The rules of processing, fat content, and glycemic load. In animal studies, right working for sugar-fat combinations show binge-like patterns and withdrawal symptoms akin to those seen with